Hi family, welcome back to my channel. So in today's video I am talking about Viagra. Is it the best medication for erectile dysfunction? Well, I'll be comparing it with Cialis and of course Viagra. I'll also talk about the effectiveness and some of the factors that affect its effectiveness. If you're new on here, my name is Nana. I'm a pharmacist and I like to create content on pharmacy, health, and of course medication. If these are some of the things that you're interested in, then why don't you subscribe to my channel and let's all learn and educate ourselves. So before we talk about what Viagra is or compare it to the others, let's briefly talk about what is erectile dysfunction. So erectile dysfunction is known to be a man's inability to get an erection, and of course a man's inability to keep or maintain an erection long enough for sexual intercourse. There are many factors that can contribute to an erectile dysfunction, and of course there are many causes of erectile dysfunction. There is psychological causes, there is physical causes, and of course there's lifestyle factors that can also contribute to having erectile dysfunction. So some of the factors or some of the causes of erectile dysfunctions are: one, side effects of the medication that you take. So certain medications such as antidepressants, antipsychotics can cause erectile dysfunction. Again, if you have certain conditions, then you are at risk of having erectile dysfunction. Some of these conditions can be high blood pressure, high cholesterol, having diabetes, and of course having certain hormonal conditions. Some of these conditions can be underactive thyroid and overactive thyroid. Let's talk about some of the lifestyle factors that can contribute to erectile dysfunction. So if you're a heavy smoker or smokes in general, if you're someone that drinks too much alcohol, then these are some of the factors that can cause erectile dysfunction. Let's move on by talking about what are the treatment for erectile dysfunction. So treatments are generally based on the causes of erectile dysfunction. So it's important to know that Viagra and other erectile dysfunction medication are normally used to temporarily treat erectile dysfunction. They are not long-term treatments. If you want to treat your erectile dysfunction, then it's important to treat the underlying cause of your erectile dysfunction. So let's talk about Viagra, Viagra, and Cialis. These drugs belong to a group of drugs known as phosphodiesterase inhibitors, PD5. They all work in similar ways. They work by relaxing the blood vessels which supply blood to the penis, meaning that more blood can get there when aroused. These medicines are not aphrodisiacs, so you still need to be sexually stimulated in order to get an erection. So Viagra has been around the longest compared to the other two. So we know more about its effects and its side effects. It's been around for more than 20 years. Viagra is also known as sildenafil. Sildenafil is the generic name for Viagra. You can get Viagra over the counter, so you can get 50 milligrams of Viagra over the counter as Viagra Connect. So Viagra is to be taken on an empty stomach, so no food, and it needs to be taken 30 minutes to an hour before sexual intercourse. You need to avoid alcohol if you're going to take Viagra, because alcohol can interact with Viagra. I'll talk a bit more about it later on in the video. Let's move on by talking a bit more about the side effects of Viagra. So some of the side effects of Viagra can include nausea, headache, dizziness, flushing, so including hot flashes, indigestion, nasal congestion. So Viagra is available as 25 milligrams, 50 milligrams, and 100 milligrams. Some people start on the low dose of 25 milligrams. It all depends on what your healthcare provider prescribes for you. Let's talk about Viagra. So Viagra is similar to Viagra. However, it is not affected by food or alcohol. Its effect again is 46 hours, again similar to Viagra. And there's also some evidence that Viagra is more effective in diabetics than other erectile dysfunction medicines. So what about Cialis? So Cialis effectiveness is more than Viagra and Viagra. Cialis effectiveness can last up to 36 hours. Yes, up to 36 hours. However, some men do not like taking Cialis because of its side effects. So let's move on and discuss some of the factors that can make Viagra less effective or that can stop Viagra from working at all. So Viagra has a success rate of 60 to 80%. Some people might find it effective and some people might not. Bear in mind, it will not work for everybody. So let's talk about some of the factors that can affect the effectiveness of Viagra. You're taking Viagra incorrectly. Viagra is meant to be taken 30 minutes to an hour before sexual activity. If you take it sooner, then the amount of sildenafil circulating in the bloodstream may not be enough to make an impact. Again, if you take it 2 hours before sexual activity, it will not also be enough to make an impact. So it's important to adhere to the instructions. Another factor that can make Viagra less effective is alcohol. Alcohol and Viagra work in opposing ways. Alcohol reduces blood flow, making it difficult to get an erection, and also inhibits certain pathways that are needed for getting an erection. You should avoid alcohol altogether. So another factor might be you might have an underlying health condition. So as I mentioned earlier, certain conditions put you at risk of having erectile dysfunction. So if you find that you're taking Viagra and it's not working, then speak to your healthcare provider, be able to find out what is causing your erectile dysfunction. If you're also eating too much, then of course Viagra wouldn't work. So it is important to take Viagra on empty stomach. Do not have fatty meals if you're about to take Viagra, as this will stop your Viagra from working or it will reduce its effectiveness. And if your Viagra does not work at all, again, it could be a psychological problem. So your mental state is also important when you're about to have sexual activity. Speak to your healthcare provider and mention to them, especially if you have anxiety, depression, or you're stressed, then it's important for them to signpost you to a therapist to help you manage or treat your erectile dysfunction. Finally, if Viagra doesn't work, then as I mentioned earlier, there are alternatives. So there's Cialis, which is sildenafil, and of course there's Viagra. These are all erectile dysfunction medication that you could try. And again, if none of them work, then there is underlying health condition or there is a psychological condition. So you may need to speak to your healthcare provider for them to suggest alternative. All right guys, I'll end this video here. If you enjoyed watching this video, as always, give it a thumbs up, share it with your loved ones, and don't forget to subscribe to my channel. I shall see you all in my next video. Take care. Bye.